We start with the session 2. Albert Einstein said the only source of knowledge is experience. Hence, by sharing experience, we increase knowledge, and that's what we intend to do here with 3 eminent speakers sharing their experience on digital adoption. Welcome to the session 2, Global Experiences of Digital Adoption. We have 2 chairpersons for this session. First, I would like to introduce Mr. Amit Mookim, Managing Director, IQVIA South Asia. Amit has been a management consultant turned into a business leader and currently oversees the India operations at IQVIA. His experience in digital health has extended to supporting innovation and entrepreneurship in India. An advisor to the NHA on innovation, president at Indus Entrepreneurs Mumbai, and mentor to health startups. As a young bright partner, Amit worked extensively towards growth of his earlier firm KPMG, spreading its base across 11 countries. Those who don't know, Amit is an amateur marathon runner and also coaches entrepreneurs on managing stress while being centered in spirituality. Welcome. Our second chairperson is Dr. Anil Chillimuntha. He's the Vice President of Meta's Group of Adventist Hospitals and has a vast experience of more than 2 decades in healthcare and has been serving as NABH assessor since last 12 years. Also the Vice President of Surat Hospital Association, member of Action Committee for COVID Management for South Gujarat, and Professor and Head Department of Business Administration, Surat, an alumnus of IMA Ahmedabad and Manipal University, with many publishing books, research articles, both in national and international journals. The speaker for the day is Mr. Rani Shifron, the founder, Healthier Globe, Israel. Director and creator of Taiwan-Israel program, Innovation to Industry, launched in Taiwan to help scale Israeli innovations into Far East to Taiwan. Mr. Shifron has vast experience in global technology evaluation, product sourcing, and relationship building, an accomplished team leader, speaker, and coach. I welcome you all, and now I hand over the session to the chair to take it ahead.
Thank you, Bhavisha, and a very good afternoon, good morning, good evening to all our global audience. And first of all, on behalf of IQVIA as well as my co-chair, Dr. Anil, who I'll hand over very quickly, thank you for having us on this panel. And thank you to the panelists from across the world who will give us a perspective. But we also have Rani from Israel, who today as a country epitomizes global innovation. And I'm sure that it's going to be a very, very exciting panel, especially given the dynamic situation and time that we are in, where we don't even know 3 months down the line what would be some of the dynamics in the healthcare ecosystem. And hence, this panel is very, very timely.
We know that today we have the digital health, which is moving at a gradual pace, especially in our country like India. But if you look at other countries, they are at a very advanced stage of moving towards digital health. And we know that even though various industries have taken the leap forward much faster and they are much ahead, the healthcare industry is moving at a smaller pace when it comes to even the world across. But there are a few countries which have processed themselves, which have equipped themselves and moved very innovatively to adopt digital health.
Let me now step in and ask Rani for his views. Rani, I have so many questions to ask you, but given Israel is at the forefront of global innovation, but the one question that I want to start with is, Israel was always in disruption, creating disruptive technology across healthcare, defense, etc., even before pandemic. What has shifted post-pandemic? If you look at pre and post, how has innovation shifted?
Thank you, Amit. Thank you for having me today. Basically, as you said, Israel has been on the forefront of innovation In digital health, we have about 800 companies, different sizes, of course, active in this space. And I'll talk about what has happened in the last year later. But as far as innovation is concerned, I mean, this was mentioned before. COVID has made a substantial difference, both in the use of telemedicine for physicians and patients, which were reluctant before. And this has basically pushed this forward at least by a decade, if not more. But even more so, what we saw is immediately the whole ecosystem jumped in to innovate new solutions. And I'll give an example. There was a global shortage of ventilators. So the Ministry of Defense jumped in with several different military contractors to bring about a quick solution, meaning all hands on deck for the whole ecosystem, not just the Ministry of Defense and the contractors. They involved companies, they had call for help, and it was all hands on deck. And within a matter of weeks, there were several different solutions available, and they picked one which was taken to mass production. So basically having a solution which Israel didn't need outside help moving forward. Now, I mean, and there are many other examples like this. So Israel has been able to bring about lots of different solutions, and there's a government body under the Ministry of Health called Healthcare Israel, who's now sharing the experience globally with other governments. So it's not you know, keeping it to itself, but sharing. So just to answer your question, innovation pre was okay, it was silo. Innovation post is more collaboration, and we see that continuing past the crunch period. We see that continuing, and we're going to see it bring about lots of different additional solutions.
Thank you, Rani. I just have a follow-up question before I hand over back to Dr. Anil. But Rani, I'm picking up from what Dr. Su said, right, on the trade-off between patient satisfaction and physician engagement, right? And spend being one factor of that. I wanted your reaction on that comment and the experience of Israel here. If it's the same, it's different, and if it's different, why?
Yeah, I think part of the answer to this, in both Taiwan and Israel share a common interest, is we have both been gathering all the patient data for the last 25 years or so, plus minus. So we're both very advanced as far as looking at the data, but I think the COVID has brought about, again, has brought about a different relationship, both on the physician side and the patient side. You know, people were more skeptic going to get treated, so they were looking for solutions, whether it's through apps or other solutions, and I can bring about and many different examples of companies who have brought solutions to monitor patients from the home. So I think the mistrust or the skepticism from physicians and patients has completely vanished because of COVID, and we're not going back. It's definitely going to be a hybrid model moving forward.
Thank you. Over to you, Dr. Anil.
Thank you. Professor Rani, I have got one more question for you, which would be, in case you're looking for monitoring patients from home, what are the kind of digital technologies that you must have used to monitor the patients at home, or you must be having a remote monitoring for the ICUs. So what is it that Israel must be doing in these lines?
Okay, so the advent of AI is bringing about digital adoption, creating more personalized care. And some examples for monitoring patients from the home, and I'll bring some companies' examples, is Tidal Care. They have a device where they do in-home exams for heart, ear, lung, throat, skill, and abdominal. And they have a infrared thermometer, otoscope, stethoscope, tongue depressor. And that, once COVID hit, immediately the HMOs kicked in, adopted it, and built a kit around that to help monitor COVID patients from the home, to alleviate, patients crunching the hospital system. Other examples are Natira. Natira does contactless monitoring to avoid the rehospitalization of chronic patients. It's basically a radar-based, a high-frequency radar-based technology. It just senses the vital parameters, both in real time and in spot check. The Ministry of Defense has locked onto that, and with other technologies to help bring quicker solutions to the market. Other ones are, and this is something that's been an issue for many years prior to COVID, and solutions to combat prescription and non-adherence. I mean, the problem globally is 50 to 70% of the patients do not adhere to their prescriptions, and there are now solutions to help, smart applications to help combat that issue, as well as global mental health apps and so forth. So we were looking more holistically at the issue, what solutions we're looking for, and basically the solutions are going to be even greater, because what we're seeing today is a cluster being created, meaning companies are starting to collaborate between themselves to bring solution. Just last week, Zebra Medical was purchased. Zebra does imaging AI to be able to help physicians identify issues that they may have missed. They were purchased by an imaging company. So we're going to start seeing more and more integration of companies to bring wider solutions, and this is going to be cross-national. It's not going to be just local. So clusters and cross-national collaborations are going to be the key. And I think, a good quote I found on that is Dr. Nadav Shimoni says, "The digital health alchemy game has begun. While the successful matchmaking of different technologies, business modes, and company cultures is far from trivial, especially given the rapid pace, whoever is able to think ahead, aim, and execute the right combos stands a chance to win big." So this is what we're seeing already. It started, and I expect to see much more of that. And being involved with the innovation ecosystem, I hear and see that on a daily basis.
Thank you, sir, for that wonderful explanation.
I had a question, and this is for India, right? You both would be aware that we are in the process of building out our universal healthcare platform. We launched a very ambitious program which is underway. And last year we launched the National Digital Health Mission, which is the whole technology architecture, right? There are there are 3 or 4 big stakeholders, right, in this whole success of this. There is, of course, the public health system. There is the private hospital and private practitioners. There is the patient, and then there is the allied health ecosystem. I would really, value your opinion here on what are 1 or 2 of the things that we need to probably look at to accelerate this build out, because we can't do it traditionally given the size and scale our country is and the time at which we are starting with so many variables. I know it's an open question, but it'll be very valuable to hear from both of you on any specific points here.
Well, I mean, if I look at Israel experience, the way we've been successful is we brought everybody to the same table. And the government drives this, whether it's through the Ministry of Health or through other initiatives. The government drives the big strategy and the initiatives. The HMOs execute. Okay, Israel has 2 major HMOs and 2 other smaller ones, which cover the whole population. Everybody gets health care through one of the HMOs. So I think number 1 is get everybody to sit at the same table, with leaving the egos outside and trying to cooperate. And the next and big thing is obviously trying to make things simple, keeping it very simple to monitor, and also having enough budget to do this. Now, whether it's government budget or whether it's we privatized a lot of the initiatives to the private sector, and so they get some sort of license from the government for a certain amount of years if they're investing in it. So it's a combination of all 3, and I think I mean, I'm very well aware of the complexities you have in India. It's not a simple not a simple answer to ask that, but I think if we get people like we have here on the panel to talk and brainstorm, I'm sure we can have ideas. Another one initiative that I've been trying to put together is the cross collaboration of the patient data. And for instance, like I mentioned, both Taiwan and Israel have at least 25, if not more, years of patient data, and collaborating that with US data, with India data. I'm sure that will bring about better solutions for medical care and personalized care.
Thank you for that. And over to you, Amit.
So this is a question again for both Professor Su and Rani. Again, given the Indian environment, can you share with us examples of 2 innovations that you have in your countries that could be relevant for the Indian market to accelerate whatever we are trying to do?
Just to make it short, I think there are several technologies which would help India, especially bring about proper healthcare to rural areas, remote patient monitoring, because 5G is rolling out, this will allow for lots of different apps and a lot of different solutions like CAHOTECH and the Tira that I mentioned, and there are many more, but this is definitely the solution and the way moving forward.
Thank you, Rani. I do know that a lot of Israeli companies are very active in India as we speak, and partnering with both private providers and other parts of the the healthcare ecosystem. One last question. I know we have a few minutes to wrap up, and this is more specific to the pandemic, right? I think there are questions each public health system is asking. One of them is, how do you balance the allocation of resources between the management of the pandemic and the ongoing disease burden? And for India, it's a big question, right? As our resources did get stretched during the waves. And my specific question is, could you give one example of how technology or digital adoption could play a role in at least putting any kind of ease to this problem?
I can start. Again, starting with the pandemic, we immediately, the HMOs immediately moved to communicating with the patients via their mobile phones, and have brought about lots of different remote solutions, and I think and again, initially a lot of the regular workload of the hospital was put aside, elective surgeries and so forth, and focusing on creating corona type departments. But as time went on, we saw that there was less need for that, and they were able to manage the balance better. Today in Israel, we're seeing an influx of Delta variant and starting to to get an up spike. So again, it's the question of the balance. But I think the hospital systems have had enough experience in the last 18 months to be able to manage this much better. Of course, what we found is that we need, and this is globally, I'm sure, that we need to invest more in our healthcare system. And that's why you're seeing a lot more investments come into the space today, because the whole world and all of the corporates understand that there's much more to be done here.
Thank you, Rani. And I think we are at the end of this this panel. To me, I have taken away quite a few things, but the big thing I took away was the paradox between the happiness levels of various stakeholders, and to be prepared for that as we move along, right? So have a great day, great evening. Thank you so much for joining us and sparing your time. Dr. Anil, it was a pleasure to co-host this with you, and thank you to CAHO to give us this opportunity to have this discussion.